Hello everyone and welcome to Dental Diaries.
I'm Miranda.
And I'm Mira.
And today's topic is guard duty.
Did you know that grinding and clenching, what in dental world is called bruxism, can lead to severely damaged teeth and gums? Let me ask you, have you ever woke up with sore pain in your jaw?
Has your wife or husband ever kicked you in your sleep because you made a sound like you were chewing rocks in your mouth? Or have you noticed that your gums are receding?
If you nodded at least once, please address those issues with your dentist at your next checkup appointment.
Trust us, there is a solution. Our office has a solution. You may need an appliance that can fix all of those problems.
Today on our episode, we will be talking about a night guard or day guard. In the dental world, we call it an occlusal guard. And also what bruxism means to our health.
Let's briefly discuss what's happening with our teeth when we grind or clench involuntarily. Day after day, without treating bruxism, our teeth can easily fracture, chip, or get loose, or even grounded down.
Then also, tooth enamel wears erratically. You start noticing that your teeth become thinner or flatter, which also causes extreme sensitivity to hot and cold. Wearing off the enamel increases the risk of cavity and tooth decay, leading to need of fillings or crown work, in worst case scenario, the root canal.
We see a lot of patients coming with symptoms of soreness and jaw pain. When you're asleep and you grind and clench your teeth, your muscles are becoming tired when they've been working out all night and they're upset in the morning.
Did you know that if you don't treat bruxism, it can lead to sleep apnea, a sleep disorder that can make your life a nightmare?
So here are a few things that you can do to help prevent bruxism. It may sound crazy, but consuming alcohol and tobacco products, especially in large amounts, or even caffeine, can cause dramatic grinding at night.
You need to reduce stress levels. Find the stress-causing factors in your life and try to fix it or prevent them, and come to grips with what is causing the stress. We need our beauty sleep. Don't let grinding or clenching ruin it.
And finally, one of the most effective ways to treat bruxism, and what we'd like to talk more in detail about, is an occlusal guard. Some patients say that it's been their lifesaver. Most patients find it as the only solution to treat the disorder.
So occlusal guards are made of special material, could be hard or soft, depends on the doctor's recommendations. So it's usually made by a laboratory. Dentist takes impressions and bite registration, then sends it to the lab. And in about 8 to 10 business days, your appliance is ready.
There are a few different types of occlusal guards. You can call your dentist or call our office. Our doctor will be happy to discuss what type of guard is best for you.
We also need to mention that there are an option to buy a night guard over the counter. However, you may want to treat this as a temporary night guard. They are not meant for long-term use.
They may seem comfortable at first, but they wear down quickly, depending on the severity of a person's bruxism.
They can also easily fall out of place, causing you to choke or simply lose the preventive effects of them.
That is frightening. And keep in mind that most insurance companies do cover night guards, so please don't hesitate and call your doctor for a consultation.
Earlier, we talked about a gum recession, that it could be a result of severe bruxism. So follow us on our next episode. We will be talking about non-surgical treatment for gum recession. It is a really cool procedure.
That's all we have for you today. We'll see you next time on Dental Diaries.
Thank you guys. Bye!